So there's something which is called as clomiphene resistance and clomiphene failure. So what is meant by clomiphene resistance? Clomiphene resistance is that even after 3 cycles of ovulation induction, and you have given the maximum dose, that is you have given 150 milligrams. So the dose, let's talk the dose also here. The dose of clomiphene citrate is going to be 50 to 150 milligram. The 150 milligram is the maximum dose. So when you are starting with clomiphene citrate, you can start with low dose, which is 50 milligrams, and studies have said this 50 milligram can, if you give 50 milligram, 50% will become pregnant. So the effective dose, you can start at low dose 50 milligrams and you can increase the dose to a maximum of 150 milligrams per day. So this clomiphene citrate, so resistance is that even after 3 cycles of ovulation induction and you have given the maximum dose of 150 milligrams for 5 days, and even that there is no ovulation. So if this happens, this is called as clomiphene citrate resistance. And what are the causes of clomiphene citrate resistance? This can be mainly because of PCOS. So in PCOS, you will see hyperandrogenism. So hyperandrogenism can also be a cause for clomiphene citrate resistance. Obesity and hyperinsulinemia. So all these causes can cause clomiphene citrate resistance. So what can you do when you see a patient of clomiphene citrate resistance is that, so you can either advise diet lifestyle modifications, you can give metformin, and also you can switch over to the next drug which we'll be talking about will be the letrozole. So letrozole is highly effective in PCOD patients. So that is regarding clomiphene resistance. The next will be the clomiphene citrate failure. So what is meant by the clomiphene citrate failure is that even after the same 3 cycles with maximum dose, with ovulation, that is ovulation has occurred, you have retrieved the oocytes, ovulation has occurred, but still there is no pregnancy. So that is called as, so here ovulation is happening, the oocyte is getting released, but there is no pregnancy. So in that case, this is called as the clomiphene citrate failure. So the side effects of clomiphene citrate, you can see it's an anti-estrogen. So it will be more like menopausal effects like mood swings, hot flushes, abdomen distension, breast discomfort, nausea, vomiting, visual symptoms, multiple pregnancy rate because of the multifollicular development, adverse effect on cervical mucus, and sometimes it can also lead to the formation of ovarian cyst. Another point in clomiphene citrate which you have to keep in mind is that, so a single dose of giving 100 milligrams of clomiphene citrate, when you give it for 5 days, this can remain in the blood for 30 days. So see, so single dose of 100 milligrams when you're giving for 5 days, this can remain in the blood for 30 days. The half-life is 5 to 6 days. These are some important points about clomiphene citrate. Another thing is that when to start clomiphene citrate, there are two concepts. Some people start at day 5 and some people start at day 2. So what is the difference when you start at day 5 and what is the difference when you start at day 2? So when you start at day 2 is that already the follicular recruitment has been happened. So in this time when you start the clomiphene citrate, it will lead to the development of monofollicular growth. So because by day 5 the follicles have been recruited, the rest of the follicles have underwent atresia. So more or less only one dominant follicle is going to grow and you are going to help in stimulation of that follicle. So in day 5 when you start, there will be a monofollicular growth. But when you start at day 2, that is the recruitment has been started at this time when you give clomiphene citrate, the entire cohort of follicles will be recruited. So this leads in multifollicular growth. So in general practice we start at day 2 and we start with 50 milligrams for 5 days. And then you can also increase the dose depending upon the response.